Indigestion. Indigestion is a medical word that refers to a functional issue with no evident cause, such as ulcers, inflammation, tumors, or biochemical alterations in the upper section of the stomach. This disorder is often persistent, or has a propensity to disappear in reappearance, and it is a prevalent problem that affects roughly 7% to 25% of the population in developing countries. Symptoms of indigestion. Indigestion symptoms include pain, tightness, and swelling are all symptoms of a bad sensation. A sense of satiety and fullness, even after a light meal. Constipation. Digestion problems. A scorching sensation. Vomiting. Throwing up. Indigestion symptoms can emerge in a wide variety of ways, including all or a substantial portion of them at the same moment, or various symptoms at different times. Symptoms might be modest, having little impact on the quality and regular course of life, or they can be severe, impairing quality of life and everyday functioning severely. Indigestion causes and risk factors. Indigestion can be caused by a number of things. Disturbances in the stomach's mechanics, particularly a delay in removing food from the stomach. A flaw in the adaptation system, as well as the stomach's appropriateness for the food it receives. Hypersensitivity of the stomach to all discomfort sensations. Infection with Helicobacter pylori. Hazard factors. Psychological elements include things like susceptibility to depression, worrying tendencies, complications of indigestion, indigestion complications, esophageal stenosis, pyloric sphincter obstruction, pyloric stenosis, peritoneal peritonitis, indigestion diagnosis. If the symptoms are minor and there are no severe signs to be concerned about, such as weight loss or swallowing difficulties, no specific tests are required for the diagnosis, especially if the patient is under 45 years old. In some circumstances, the doctor may believe it is necessary to laboratory tests, upper gastrointestinal imaging studies, such as endoscopy, imaging with ultrasound. Treatment for indigestion. Treatment is determined by the severity of the ailment, and it can be summarized as follows. 1. Treatment of minor conditions. In mild occurrences of the disease, treating dyspepsia is unnecessary, simply reducing stress and anxiety is enough. 2. Dealing with challenging cases. The following is the treatment for the most problematic cases. Medicines that neutralize or lower stomach acid productions can help many people by alleviating their symptoms. Helicobacter pylori elimination. Trying out medications to alleviate constipation and speed up stomach emptying, however their efficacy is still in dispute. In the future, researchers predict that medications that change the sensitivity of the stomach and the ability of the stomach wall to adjust and relax will be the solution to this problem. A variety of medications with these qualities are currently being investigated and tried today. Preventing indigestion. To avoid indigestion, take the following steps. Eat small meals frequently. Consume food gently. Stay away from acidic meals like tomatoes. Stay away from caffeine.